So we currently have two vaccines that are approved. One is from Pfizer, the other is from Moderna. There's several others that are in development. And the ones that have been approved from Pfizer and Moderna are very safe. But it's important to stick around after your vaccine to make sure that you don't have any adverse side effects.
You can think of your side effects, your potential side effects, in a couple of different categories. First, you might have some pain and swelling in the arm where you got your injection. This is normal. Secondly, you may actually have a little bit of a headache, some fatigue, maybe some flu-like symptoms in the day or two after you receive the vaccine. These should be fairly mild and go away with time. If you have those adverse effects, you can always consider talking to your pharmacist or your doctor about using ibuprofen or acetaminophen over the counter as a pain reliever. If these effects are severe or they don't go away after a couple of days, that's when you want to make sure you talk to your doctor.
So as soon as the vaccine is injected into your arm, and within 24 hours, many people feel soreness, redness at the injection site. That means your immune system is already working. However, it takes about 1 to 2 weeks after your immunization for your antibodies to peak and to provide you some level of protection. The important thing is that your first vaccine doesn't give you the level of protection that you need to prevent you from going in the hospital. And it's the second dose that really helps your immune system generate all those antibodies to really protect you.
You may feel a little bit tired. You may feel a little bit like you have some flu-like symptoms after the vaccine. If so, adding some hydration to your routine can help. You can also talk to your pharmacist or your doctor or healthcare provider about potentially using Tylenol or Advil to help with that pain or that little bit of fever. In general, you'll be fine to go back to normal activities. If you have severe adverse effects or those that last more than a couple of days after the vaccine, you want to make sure that you talk to your healthcare provider.
So it's important to be aware that the symptoms can range in all different individuals. Some small percentage may have no symptoms at all. Most people will feel soreness, redness at the injection site, and others may have more severe symptoms like fever, chills, what we consider flu-like symptoms. And it's important to know that those symptoms really come from the fact that all of our immune systems are built a little bit differently, and the response to the vaccine indicates the differences in our immune systems. So it's important, even though these symptoms are different, the vaccine, according to the data, is working as it should, and it's important to get your second dose. So the vaccine is designed to keep you out of the hospital. When you get this vaccine, you may still become infected, you may still transmit the virus to other people. And so it's important after you get the vaccine to continue wearing a mask, continue physical distancing, and continuing to wash your hands. And that protects the other people around you in case you do become infected. This will keep you out of the hospital, but do those things to keep other people out of the hospital.
You know, the challenge with this virus is no one had immunity to it until we began to see people infected with it in 2020. With a vaccine, it allows us to develop immunity without being infected. As more people in our community become immune to the virus, there's less chance that you will encounter the virus circulating as you go about your normal business. And so really the benefit here is the protection of those among us who are most vulnerable to the virus, as well as just getting back to being able to go to work and go to the grocery store and go to sporting events without always being concerned of being exposed to the virus. So the most important things that you can do during this time frame are, number one, please make sure you make an appointment and come back for your second dose. You don't actually get full benefit of the vaccine until you have that second booster shot. And number two, until we can get the majority of our population vaccinated, please continue to take health precautions. Wear your mask. Make sure you stay away from people who don't live with you. Make sure if you're going to have an event that it's a socially distanced event. Ideally, as the weather gets better, have that event outside. We're going to get to the point that you don't have to wear masks and you don't have to stay away from folks that don't live with you. But we're not at that point yet, and we really need your help to get through this next season.